What's up everybody, Mr. J here. I'm so glad you're joining me here for this HESI exam review. Chances are if you are watching this video, you really want to understand the background of anatomy and physiology so that you can do well on your HESI exam. The issue is there's so many concepts in A&P that it's hard to understand and narrow down exactly what you need to know for the test. That's why I'm here. So what we're going to do in this many-part series is I'm actually going to have several practice HESI questions. I'm going to go through them, give you a chance to answer to see if you can get it right first off. But then after answering the question, I'm actually going to have a short teaching demonstration so that you understand the concept behind the question. That way, whatever question they throw at you during the exam, you will know how to answer it properly. So, as we go about it, I'm going to start checking off how many topics were represented in these questions. That way you can kind of get a feel for how many questions will be associated with each topic. Now, it might change every year depending on the HESI, that specific time, but we'll do our best to portion it out for you. So let's get started. First question is, the pyloric sphincter is located between what structures? Okay, so the pyloric sphincter is located between which structures? Well, we're dealing with the digestive system, specifically the alimentary canal, which is basically the tube of your digestive system from mouth to anus. And there are many sphincters, sometimes they're called valves, between the mouth all the way to the anus. So let's talk about those. So first off, I'm going to draw like a Pac-Man head because I can't draw anything else. Oh, my dog's getting kind of excited. Then you've got the esophagus that will go down and it will open up into the stomach, okay? And then we've got the long tube of the small intestine. It's the longest part of your digestive tract, followed by your large intestine. I'm not representing it perfectly, but it'll have an ascending section. So let me kind of go down here with the small intestine. There we go. So we'll have an ascending, thank you, Gracie, transverse, and then descending colon that'll eventually end in the anus. So there you have it. Here's your digestive tract. So once again, here's your small intestine here. Here's your large intestine. Here's your stomach. And here's your esophagus. Esophagus, if I could spell. Wonderful. So let's go through these real quick. So first off, when you swallow food, it's going to go through the first valve, which is called the upper esophageal valve. Upper esophageal valve. That's an easy one to remember because it's on the top of the esophagus, right? Then we've also got the lower esophageal valve. So I'm just going to say lower esophageal valve. This one is also known as the cardiac valve or cardiac sphincter as well. Okay, so make sure you know that the lower esophageal valve is also called the cardiac sphincter. Sometimes it's called that. Next, we get into the stomach. Okay, this is when food's going to mix together. And here's our answer. The pyloric valve or pyloric sphincter is located right there. So this is the pyloric sphincter. Okay, and that's going to separate out the stomach and the small intestine. There's a few more valves that answered our question. There's a few more valves to know about. Once you get through the small intestine, you're going to have the cecum or the cecal valve. Okay? And then as it goes through the large intestine, eventually you're going to have your internal and external anal sphincters. So internal and external, obviously meaning inside and outside. And this will be your anal sphincters. All right, so those should be all the valves represented in the digestive tract. So hopefully that was a good short demonstration. Let's get to the next question. Okay, so that was actually one score for the body system of the digestive system. So I'll write digestive and we're gonna add a tally there. Okay, so one question for digestive system. The next question, there's an imaginary line that separates out the upper and lower halves of the body. What's that called? I don't like the word line. I think they're asking for plane. So the imaginary plane that separates out the upper and lower halves of the body. So that would be the transverse plane. So that's as if you were going to cut me in half and peek inside. That would be a transverse plane or a transverse section. So that's transverse. So that separates out, obviously, upper and lower halves of the body. If it's a sagittal section, it's going to go in this direction. So as if you were going to take this paper and cut me right in half, So I'm separating out my right and left sides, and then you're basically going to peek inside of me from the side. So your sagittal basically cutting down the midline, okay, separating out right and left, and then you're going to peek inside. So you're going to view it from a side view. That can be a mid-sagittal section, or it can also be a lateral sagittal section, basically doing that same plane in different areas of the body, okay? Once again, just looking from left to right. Then the last one would actually be to cut the front or anterior side from your posterior side. This would be called a coronal or a frontal plane, okay? So that's separating out anterior, front, or posterior, back. And then you would actually view that from the front or back in a coronal section. The way I remember coronal is coronal means crown, and when you place a crown on somebody's head, you kind of do it like this, separating out the front and back parts of your body. Awesome. So that is a score for planes and directional terminology. So let's get it there, and let's get into the next question. Okay, here's a multiple choice question, so I'll hopefully write it out on the screen for you. Which is not an exocrine gland? Okay, so here are your options. Digestive enzymes, milk, saliva, or adrenaline? Okay, think, pause the video if you need to. The answer would be adrenaline, because adrenaline is actually a hormone. So in hormones, if you see a hormone, you know that this is going to go into the bloodstream. Okay, and if something goes into the bloodstream, it is considered, well in this case, an endocrine gland. So endo literally means into, crying literally means to cry. So we're basically secreting something into our body. Where is inside of our body? Specifically, our bloodstream. Whenever it's an exocrine gland, so if it's an exocrine gland, this is most other glands, to be honest, because these most other glands, I should say, will secrete their stuff out of the body. Okay, so let me give you some examples of these guys. Your sebaceous glands. Okay, so sebaceous glands produce that kind of oily smell to it, the waxy stuff like underneath your armpits and in your inguinal areas. You have sweat glands that are going to secrete sweat outside of your body, basically from the sweat glands out onto your skin. These will be interesting. We said digestive enzymes were exocrine. But you may argue, hey, doesn't this go inside of our body, right? Because it's dumping into our small intestine, right? Well, technically, the inside lining of your intestinal tract, that alimentary canal, is the outside of your body. Why is that? Well, think if you were a elastomer and you stuck your hand down your mouth all the way through the stomach, down through the anus, and then eventually could pull it out. That's because the inside of your digestive tract is continuous with the outside world. So even if it's going into that digestive tract, it is still considered exocrine, okay, because it's secreting out. And all of these will have something in common too. They will have what's called a duct that leads out of the body. So if it asks like, hey, there's a gland that has this duct, is it exocrine or endocrine? It's always going to be exocrine if it has a duct. Great, so that's another score for the digestive tract actually. All right, let's get to the next question. All right, here's your next question. How would you classify epithelial tissue? All right, so we got a tissue question here. So epithelial tissue. If you look at the word epithelial, what it literally means is epi means on top of, and ethelial means sheet, okay? So it's like a sheet that's on top of something. That's because the epithelial tissue in your body is the linings of your body. Okay, whether inside or outside. So your skin, for example, would be considered an epithelial tissue. If anything you touch as you're pushing your hand through your mouth down the esophagus, all of that would be epithelial tissue. So both the inside and outside linings of our bodies, as well as the outside linings of our organs. So things like serous membranes would also be epithelial tissue, as well as any glands. So epithelial tissue also includes glands. Now, this is just one tissue type of 4. We also will have muscular, we'll have connective, and we'll have nervous tissue as well. These 3 have very distinct properties, but the epithelial tissue, what defines it is it's the lining of the body, whether outside, inside, or the linings of your organs. Awesome. So that was a score actually from tissues. So the levels of organization, we're going to give a score for that. Awesome, let's get to the next question. All right, here's the next question. Where are the following bones located? Okay, multi-part question. So we've got the hyoid bone. Okay, so the hyoid bone is a free-floating bone right on that trachea. Okay, so it's about right here, so it's located in that neck region. It actually prevents that trachea, your windpipe, from collapsing. Okay, so the hyoid bone is there. Your ilium, okay, your ilium is your hip bones. You got two of them, both sides, and the curve on the top of your hip would be the iliac crest. Then we've got metacarpals, okay, so metacarpals means basically middle wrist. So carpals means wrist, so it'd basically be these bones right here, all right? And then these would be your phalanges, all right? And then the carpals would actually be the small bones in the wrist itself. You can contrast that to tarsals, which is basically your hand, but on your foot, okay? So tarsal refers to foot, whereas carpals refer to wrist. Awesome, and then the last one would be the femur. Femur, it's the big bone in the thigh, come on. So definitely know your bones, where they're located. There's obviously 206 bones in the body, so you kind of need to know where those are at in order to be successful, because they could ask you any one of those bone questions. Awesome, so that is a score for, if the bones, we're talking about the skeletal system, right? Skeletal system, score 1. All right, let's get to the next question. All right, guys, the next question is, what do ligaments connect? Awesome question. So this is also going to be in the skeletal system. I'm going to get that out of the way right now. And ligaments are going to connect bone to bone. So ligaments will connect bone to bone. So for example, if you think of your knee, for example, you have your ACL or your PCL or your MCL or your, LCL, there we go. All of these end in L, that stands for ligament, okay? And these ligaments are specifically going to be connecting your femur to your tibia, okay, directly. Although that LCL kind of attaches to the fibula, so that's, I guess, an exception. But all the ligaments will attach bone to bone, okay? And they've got to be really strong, really stiff, all right? Well, not too stiff, but stiff enough to hold the bones together, right? Well, then you also have tendons. Okay, and tendons are going to connect muscle to bone. So for example, your Achilles tendon would basically connect your calf muscle to your heel, okay, the muscle to the bone, right, the calcaneus. And then you also may have aponeuroses, and these are just layers of fascia between muscles. So they're just basically connective tissue between muscles. So you may see some aponeuroses between your abdominal muscles, the rectus abdominis, okay? So that was a score kind of for skeletal system. We could kind of group in muscular system as well. So let's give muscular system some love, give them 1 point as well. Let's get to the next question. We're almost done. All right, here's a question. Which explains synovial joints? Okay, and there's a lot of multiple choice, but let's just explain what the heck synovial joints are in the first place. So synovial joints are first off the most common joint in your body, and they are very movable, okay? You can move these joints. So anytime you move muscles, okay, your bones are moving between synovial joints. So what synovial joints are, I'm just gonna take a femur tibia, for example. So say this is at your femur, and here's your tibia going down. What will be inside the synovial joint is going to be a fibrous capsule all the way around it, okay? This is thick connective tissue, basically keeps that contained, because within it, there's going to be fluid, specifically called synovial fluid. These are secreted by basically serous membranes. They're specialized cells that secrete the synovial fluid into the synovial joint. And this allows for a lot of range of motion, which you'll usually see of ROM, okay? A high range of motion. Okay, there are 6 different synovial joints that you should probably be aware of, okay? So let's roll through them real quick. Number 1 is a hinge joint. Most common, it's like a door hinge, right? Just like your elbow, just like femur to tibia. Then you have your ball and socket joint. This is the most movable synovial joint, okay? So that's going to be in your shoulder as well as in your hip. Then you have your plane joints. These don't move too much, okay? So for example, between your carpals of your wrist and between the tarsals of your feet, these bones can kind of shift back and forth ever so slightly, but not very much. Okay, so plane joints are usually just like rubbing across one plane. They're not gonna move a whole lot. Then you've got your pivot joints. Okay, just like Ross and Friends says pivot, right? They are going to turn, okay? So spin within a groove. So for example, your radius can actually spin in a little groove that's found on your humerus. So it can basically pivot inward, okay? So that would be an example of a pivot joint. Then you've got your ellipsoid joints, sometimes called condylar joints. I like to think of them as ellipsoid joints. These are going to be the joints that help you turn your head like this because it's going to have an outcropping and then an incropping, and they can kind of move on this sort of a plane, okay? Then the last one, maybe, there we go. Last one is going to be your saddle joints, okay? These are pretty rare. Your saddle joints are going to be found at the base of your thumb as well as between your sternum and your clavicle. So the same motion you can do with your sternum and clavicle is the same motion you can do with your thumb, okay? The base of your thumb. So it's kind of a partial motion. It's not as much motion as that ellipsoid joint, but it's some motion in a couple different planes of movement. Okay, so that is synovial joints. Most common, between bones, freely movable. Awesome. That's another score for the skeletal system. You can almost group that in the muscular system because we're moving, but we'll say skeletal system because it deals with joints. All right, let's see the last few questions here. Okay, finally, we have a cardiovascular question. Here's the question. Which artery carries oxygen-poor blood? I like this question because normally arteries will be carrying oxygen-rich blood, but in this case, there's one artery that doesn't. So before we talk about that, I want to just draw out the heart, okay? So I'm going to draw the heart like this. The reason I'm drawing it like this is because one side of the heart is going to be carrying oxygen-deprived blood. One is going to be carrying oxygen-rich blood, okay? So let's talk about these. First off, whenever we're entering the right atrium, okay? So this is the right side of the heart. You should know that. And here's the left side of your heart, okay? When it's coming into the right atrium, okay, this is going to be called the, vena cava, okay? So superior and inferior vena cava, okay? Basically meaning vein cave, okay? So that's going to be the vessel that's carrying blood back into the right atrium. Well, as you can see, this blood is very deoxygenated, right? So we need to get it some oxygen. Where do you reckon we should pump it to get some oxygen? Probably to the lungs, right? So when it goes into the right atrium, so I'll kind of divide it out, it'll move through this valve. It's on the right side, that's the tricuspid valve right there. Then it's going to get into the right ventricle. So this is the right ventricle. And it is then going to pump blood, not specifically like this, it'll kind of go out that direction, but I'm going to draw it like this. This is going to be through the pulmonary artery, okay? Pulmonary artery. Arteries flow away from the heart, but in this case, it's going to go to the lungs, okay? Once it gets to the lungs, then it's going to get that oxygen-rich blood before coming back to the heart, okay? So once it gets to the lungs, it gets oxygenated and comes back through the pulmonary vein. So the pulmonary vein will bring blood back into that left atrium. Left atrium will pump through the bicuspid or mitral valve. So move that blood through here to the left ventricle. Here's the left ventricle. And then finally back out to the body to basically feed the body all of that nutrient-rich oxygenated blood, okay? So that's the general flow of blood through the heart to the lungs, back to the heart to the body. Heart to lungs, heart to body, heart to lungs, heart to body. That's how it always works. And the one artery that's deoxygenated is that pulmonary artery right there. Really good question. So finally, we can mark one for the cardiovascular system. So I'll say CV system. Now, just a couple more questions. Let's get rolling. All right, guys, blood question here. So we've got two-part question. We've got one, a person with AB negative blood cannot receive from which recipient? And then the second one would be, who is the universal donor and who is the universal recipient for blood? So first off, let's have a person, here we go, and they're going to have AB negative blood. All right? Well, what does that actually mean? Well, in blood typing, if you are type A, type B, or you have the Rho positive antigen, that's going to look like this. You're literally going to have little spikes on the outside of your blood cells that basically say, hey, I belong to A, I am allegiant to A. If you're A blood. If you're B blood, same thing. They'll just be hanging out, identification tags saying you belong to B. Same thing for this one. It's just a positive antigen. It's smaller than the others. Okay? So in this case, if you are AB negative, you have the A antigen, right? You also have the B antigen. You do not have the positive antigen. If you're negative, you don't have that. You lack it. Okay? So in this case, AB negative blood, could they receive from A? They have an allegiance to A. Do they have an allegiance to A? They certainly do. So they could donate. Could B blood be donated? Absolutely, because they're also allegiant to B blood. Could positive donate to these guys? No, because their allegiance is different. In order to receive blood, you either have to be allegiant to them, have that antigen, or not have it at all. Okay, so for example, say you're type O blood. So type O negative, for example. O negative blood, if we're going to donate to them, they have no allegiance. Okay? They have a couple allegiances, but I mean, if you receive a non-allegiant blood type, that's totally fine. They don't care because they're like, hey, they're neutral. They can come to me. Okay? So that's why O negative blood can actually donate to any blood type at all. Because they're like Switzerland. They just don't cause a fuss. Or Canada for you Canadians out there. You don't cause a fuss. You'll go with any allegiance possible and you'll just be nice to them. Okay, so O negative is the universal donor. Okay? Whereas, okay, this guy was pretty selective, right? He can only have A, specifically A negative blood, and this is technically B negative blood, but he can't receive any positive antigens, okay? So, if we were to add, for example, a B antigen, so let's say we have a positive antigen, AB positive, well now we've got allegiance to A, we've got allegiance to B, and we've got allegiance to a positive. So he likes everybody, right? Because if positive goes, there's the allegiance. B goes, there's the allegiance. A goes, there's the allegiance. So he is the universal recipient. Universal recipient. Okay? So if you have questions on blood typing, definitely go online and just kind of quiz yourself. So like if B positive could donate to B negative, those types of things. That will give you more practice, okay? So that was another score for the cardiovascular system because we also talked about blood. So vascular means the blood vessels, so we're talking about blood. So there you go. Hey, thank you for joining me on this episode of the HESI exam. I will have several more videos after this, so feel free to just watch them in a loop. And if this was helpful for you, just to help me out, if you like and subscribe to this video, I would really, really appreciate the support. It helps me make better videos for you so that you can be successful in whatever you're going into in the medical field. Once again, this is Organized Biology. Thanks for watching.